for Trudy, who's asking for, talking about what this slide is taking you through the details of what we heard from you with respect to what we were doing, what the program was doing well, and in what areas we could be making improvements to the program. So, you know, you liked the retirement plan, the defined contribution pension plan, the disability plans, which is the short-term and the long-term disability plan, the EAP. These different elements are what you enjoyed about the program, but really thought that we could improve on the long-term disability costs, give a better opportunity and option for vision care and dental care, give some more flexibility on the choices of the plans, etc. So as we went through the request for proposal, these were the elements that were top of mind. And as we went through that, Manulife came out as the top provider that could deliver against these requirements. So the intent of this new program is to provide you with choice. So to be able to choose from a menu of different options to suit the unique needs of yourself and your families. And with Manulife being one of the largest insurance providers in Canada, they are able to provide those options as well as provide, you know, state-of-the-art cloud tools and technology that will allow us to easily access our program. So again, just a reminder, if we could mute our phones. Thank you. So on January 1, 2019, we will be moving to a new benefits program, including life insurance, accidental death and disability, short-term and long-term disability, health and dental, and employee assistance program. These will all be administered by the new provider, Manulife. So it's a one-stop shop for these elements. And once that program is live in January, you will be contacting Manulife directly for your specific questions about the plan. Okay, so they can take your calls for an extended period of time during the day and provide you support through the phone or online if necessary. Okay, so before I turn it over to Elise, who's going to take us through the details, I just want to go through an outline of the calendar. So if we could just go to the next slide, please. Thank you.
I think it's just lagging a little bit.
Okay, no problem. This is the schedule of events kind of between now and the end of the year. So right now we are in the middle of the 2 to 3 week program where we're doing information sessions across the country, both in person and virtual, like this one today. Once these sessions are complete, the next stage of the schedule will be to enroll. So all of us, all employees across the country will need to go into the Manulife platform, create an account, and enroll in the plan using their online enrollment tool. Elise will take us through some of that detail in her slides, but we all must go into this program, create a profile, and enroll into the program that we would like to have coverage under. Once the enrollment period is over, December 12th, so there will be a period of time where Manulife gathers all that information and builds out the welcome packages and the benefits cards. So all of us will receive a welcome package and a benefits card sent to our home address. So it's important that we make sure that our home addresses are accurate and up to date in Workday, because Workday will be the data that Manulife uses for this information. So they will be coming to us asking for your addresses, et cetera, so that they can mail these packages out to you. So make sure that that's up to date. And then on January 1st, the new plan will be in effect. So when you make your choices of coverage through the enrollment period, November 28th to December 12th, you are going to be in those choices for 2 years, unless you have a life-changing, unless you have a life event, such as you have a new child, you've lost coverage somewhere else. You know, there's a definition of the life events that that you can see in the program. And then January 1, 2021 will be the first opportunity for us to go in and have a re-enrollment and make any changes to the choices that we've made. Okay, so let's get into it. So Elise, I'm going to turn it over to you, and you can take us through the program.
Thanks, Lorene. So once again, my name's Elise, and I'm here from Manulife to give you a little bit more information on the benefit plan that's going to be offered to you and the services that Manulife offers as well. So getting started, we're just going to talk about Manulife as a whole. So as I'm sure most of you are aware, Canada is one of the largest insurance companies. It was founded in 1887 and is available in approximately over 20 countries around the world. Manulife offers more than just insurance coverage. So it does have Manulife banking as well. So it's considered a financial institution. As you can see here, the ratings that we have are very high in various areas, in AA or AA, A1, so very high. With Manulife, we serve approximately 1 in 3 Canadians with one type of Manulife service at a whole. In regards to group benefit services, we do serve more than 21,000 clients. And for our group retirement services, we serve more than 10,000 clients. As you can see, we do have investments in renewable energy and energy efficient projects, $10.9 billion. We also have investment in community services, so $39.3 million, and approximately 107,000 employee volunteer hours are also as well. So again, welcome to Manulife. Effective January the 1st of 2019, your group benefits will be Manulife with your new and enhanced program. One thing to make note of is your Manulife policy number will be 113509. And your individual certificate number will be the same as your employee ID. So we wanted to make it easy for you that as long as you remember your ID, you'll know your certificate number as well. So in addition to what Lorene already went over, I'm just going to talk about what to expect over the next coming weeks and what you need to do to select your benefits. So as noted, your enrollment window is going to open on November the 28th. So at this time, you will be encouraged to log into our Plan Member Secure site and view the options that are available to you and make selections that are best for yourself and your family. The enrollment window will remain open until December the 12th, at which time any selections that have been made will be in place for the next 2 years, unless you have a qualifying life event. At the end of December, a benefit card and your welcome package will be mailed to your home address. So as previously mentioned, we do encourage that you go on to ensure that the home address that's indicated in Workday is the correct address so that there's no delay in you receiving your welcome package. In regards to health and dental claims that you have, just a reminder that any claims that incur prior to January 1st of 2019, they will continue to be sent to Mannion Wilkins, and they need to be received by January 31st of 2019. Any claims that are incurred on or after January 1st, you will then submit to Manulife going forward. When you receive your new benefits card, which will be mailed to your home address, it's going to include your transition information to Manulife, how you can connect with us, so our customer service information, your information on ways that you can submit claims to Manulife, as well as your new benefits card. So your new benefit card can be used starting January the 1st, so we do encourage you to make sure that you update your contract number and certificate number with your health and dental providers to avoid any delays or them submitting the claim to your old policy. One new thing is that the benefit card that you receive is going to be your all-in-one card, which can be used at pharmacies, dental offices, paramedical offices, as well as for out-of-country emergencies. So as you'll see here, this is a sample letter of the welcome letter that you receive and what your benefit card will look like once it's received as well. And as many of you are probably wondering in regards to any historical claims information that you have currently on file with Mannion Wilkins, any prescription drug claims that have been prior approved, they will already be continued over to Manulife, and prior authorization steps will not be required under the Manulife plan. Any estimates or predeterminations that have been submitted to Mannion Wilkins and have been approved prior to January 1st will be accepted by Manulife for up to 6 months from the date it was completed. Now I'm just going to go into further details in regards to what your new benefit program will include. So starting off, you can see that we have done a benefits redesign. So you'll see the differences in what your current plan covers and what your new plan offers. So as you can see, you currently have the 3 options of health and dental plan, but you have the same level of coverage. So if you choose Plan A, it's a health and dental for Plan A. There's no mix with this. So we've changed it that you have the option to mix and match, so with core and enhanced for health and dental. There's also the addition of a healthcare spending account, as well as critical illness and the post-retirement benefits. And you also have an expanded EAP program as well. So starting off with what your medical coverage is going to include, you can see that we have the 2 plans. So core and enhanced, which have the same maximum for annual and lifetime, so $100,000 annually or $500,000 for lifetime. Under the reimbursement amount, under the core plan, there is coverage at 75% of eligible expenses, and after there are $1,250 out of pocket, then the expenses are paid at 100%. For the enhanced plan, it's 90% of eligible expenses, and then after you have $500 out of pocket, then the expenses are then paid at 100%. You do have an out-of-pocket maximum per person as well, which is $1,250 satisfied by drugs, parameds, and medical services and supply claims under the core plan, and the out-of-pocket maximum is $500 for the enhanced plan. Under both plans, there is a dispensing fee maximum of $10. For the core plan, you see that there is a $8 per prescription deductible and a $5 per prescription deductible on the enhanced plan. Hospital coverage under both plans is 100% for semi-private room accommodations. Continuing on, you can see that we do have out-of-country and out-of-province, as well as emergency travel assistance under the plan, covered at 100% to a maximum of 60-day trip duration. Eye exams under both core and enhanced is 1 eye exam per 24 months. For prescription drug coverage, or prescription glasses coverage, there is no coverage under the core plan, but the healthcare spending account can cover this expense, which I will go over in further detail. But under the enhanced plan, there is $250 every 24 months. For the medical services and supply coverage, these services are the same between the core and the enhanced plan. For paramedical practitioners, this does now cover physiotherapist, occupational therapist, psychologist, and social worker. The physiotherapist and occupational therapist coverage are combined to $250 per calendar year for the core plan and $500 combined per calendar year for the enhanced plan. Psychologist and social worker is also combined to $250 per calendar year and $500 per calendar year under the enhanced plan. For dental, the deductible is $50 for single and $100 for family on both the core and the enhanced plan. Both policies are based on the current fee guide on the province of treatment for both general and specialist fees. For basic services, so preventative, basic endodontic, and periodontic coverage, it's at 75% for core, 100% for the enhanced plan. Major services, which includes dentures, bridges, and crowns, this is at 50% of eligible expenses for both the core and the enhanced plan. Under the core plan, there is a $1,000 per calendar year maximum combined for the basic and major services. And for the enhanced plan, it's $2,000 per calendar year, and that's for the basic and major services as well. There is orthodontic coverage under both levels. The coverage is at 50% of eligible expenses. There's a lifetime maximum of $1,000 for the core plan and $3,000 for the enhanced plan, and this is eligible for dependent children between the ages of 6 and 18 at the time that the treatment has begun. And as previously mentioned, you do have a healthcare spending account, which is a new feature that's available to you. So what this is this is an amount that Wolseley has allocated to each of you as employees for additional health coverage or health or dental coverage underneath your plan. So depending on the level of coverage that you've chosen, so whether single or family, you are allocated an annual amount. So for employees who opt for single coverage, there's an allocation of $225, and employees who opt for family coverage, there's an allocation of $450. So what this is, it provides you with the flexibility to cover any unexpected health or dental expenses that the benefit plan may not cover. So for any expenses that are health and dental, that is what's covered underneath the plan. So basically any expenses that are eligible under the Income Tax Act are what's eligible under the healthcare spending account. So how this works is at the beginning of the year, you're allocated a specific amount, like I said, depending on the coverage. You would then submit the claim to your primary plan first, and then any balance to the healthcare spending account. So just like I had mentioned, if you choose to have a dental plan that's at 75%, you can submit the initial claim to your dental plan and then claim that 25% underneath your healthcare spending account if you choose to do so. Or in the event that you have core coverage and you see that there's no vision coverage, you could then use your annual allocation from the healthcare spending account to purchase a pair of glasses as well. Just knowing that is one amount, so $225 or $450. It's not any more than that. In the event that you have any money left over in your healthcare spending account at the end of the year, it will be carried forward 1 year. So let's say you have $225 and you still have $50 left at the end of 2019. That $50 will be carried forward to 2020 and will be added to your previous amount. So let's say you had $225, so you'd have the $50 from 2019 added to the $225 for 2020, so you'd have a total of $275 to be used for that year. In the event that $50 is not used by the end of 2020, that amount would be forfeited. It's only carried forward 1 year. For healthcare spending account claims, there is a 90-day grace period to submit claims after December 31st of the year that the claim occurred. How you would submit a claim to Manulife for the healthcare spending account, you can submit the claim through our plan member secure site or our mobile app, or alternatively, if you prefer to submit your claims manually, you can also submit your receipts with a completed claim form to submit as well. Another new feature that we've added is the optional critical illness benefit. So what this is if you, your spouse, or dependent children are medically diagnosed with a covered condition which is defined underneath your plan, you will receive a one-time lump sum cash benefit that you can use in any way that you wish. So for example, if you're needing to seek other treatment options, need to make a mortgage payment or a credit card payment, you can use it however way you wish. In regards to the covered conditions, there are approximately 22 specific conditions for yourself and your spouse, and approximately 29 specific conditions that are covered for your dependents. If you're curious to know which definitions of covered conditions are available, this would be noted on the Plan Member Secure site once you've registered. To opt for optional critical illness coverage, there is coverage amounts available in units of $5,000. The minimum is $10,000, which is 2 units, and the maximum available is $150,000, which is 30 units. And as many of you are wondering is do you need to submit proof of good health in order to have this coverage? The answer would be depending on the amount of coverage that you're selecting. If you're selecting $50,000 or less, this does not require proof of good health, but anything over $50,000 would require a proof of good health for this information. So when applying for coverage, you would decide on how much you'd like to purchase. You can see what the cost is when you make that selections in the enrollment process, which I'll show you just in a little bit later. And then from there, you would just indicate the amount, and if it's over $50,000 that you're looking for, you would submit the evidence of insurability along with the request. As Lorraine had also mentioned, you do still have the coverage for long-term disability, short-term disability, basic life, and accidental death and dismemberment, both with basic and optional for yourself, your spouse, or any dependent children. We also offer post-retirement benefits, which provides you access to a full suite of individual health, travel, and life insurance without proof of good health if you enroll for the coverage within 60 days of the end of your group coverage plan. If you have any questions regarding any of the coverage underneath your plan, I do suggest that you refer to your Benefits at a Glance document for additional coverage details. This information would be available on your Plan Member Secure site. And as you'll notice with the change in the coverage as well, there is a difference in the cost per benefits as well. So here's a chart that just shows the difference for core and enhanced for health and dental, and whether you choose single coverage or family coverage. In regards to long-term disability, this is a non-taxable benefit. This is just a sample calculation of how an LTD premium would be calculated. This isn't something that you would ever have to calculate for yourself. When you go onto the enrollment process and select your long-term disability coverage, it will calculate this further for you, but this just gives you a breakdown of how we calculate it behind the scenes if there's any questions. So in regards to your enhanced employee and family assistance program, Manulife has partnered with Homewood Health to provide a full-service employee assistance program to support you at work, at home, and in life. So you do have access to this service through telephone access or online. So there is a phone number for resilience by calling 1-866-644-0326, or online, you can go to myresilience.com. All of this information is also accessible through your plan member secure site for your use as well. So going forward, I'm just going to show you the steps on what you're going to be using to enroll for the benefits. So the first step is you'll have to register your account. So starting on November the 28th, you will be able to go on to the Manulife plan member secure site to make your selections. You would start off by going to www.manulife.ca/plan member. In the top right-hand corner of the screen, you will see a yellow button that says Sign In. You'll go to For Member, and then My Group Benefits. From there, it's going to bring you to the login page, which you'll see here on the far right-hand side. And at the very bottom of the page, you're going to select Register Now. So this red square highlights the Register Now button. Then you're going to register your account information. So once again, your policy contract number is 113509, and your certificate number is your employee ID. You will complete the information pertaining to yourself, create a personalized password, and select Submit. At that time, you'll also be asked to set up 3 personal verification questions in the event that you forget your password and need to reset it. Once you've completed those steps, your account is active and you can go on from there. At that time, you also have the opportunity to sign up for direct deposit. Step 2, once you've registered and signed into the site, would be to review the benefit coverage that's available to you. So over the details that I've gone through, Manulife and Wolseley have prepared the important benefit material for you to help you make this decision that's best suited for yourself and your family. So the Benefits at a Glance is located here, which will provide you a summary of the information that's available and the coverage that's under each plan. So the documents are available for the Benefits at a Glance, as well as the Benefits Enrollment Guide for 2019. Step 3 will be to begin your enrollment. So you'll notice when you log in, at the very top of the page, it's a personalized site, and on the button on the far right left-hand side is going to say Enroll/Re-enroll. So starting on November the 28th, you'll be able to go on and do so, and make any changes between the 28th to December the 12th. You would select that button, and then you would make the selections throughout. You can go in however many times during the 28th to the 12th to make any selections, but any selections that are in there as of 8 p.m. Eastern Standard Time on December the 12th is the coverage that you will have in place come January 1st. Step 4 would be to add your dependents and update your information. So you would go on to validate the dependent information that's currently on the system. And if you have any eligible dependents who are currently not covered under the plan, you can add them at this point as well. This is also the opportunity for you to remove any dependents who are no longer eligible as well. So for instance, if you have a child who's no longer a full-time student. And then after you've completed that, the next step is to choose your benefit coverage. So like I said, you would be selecting the benefits that are best suited for yourself and your family. As you'll see here on the right-hand side, this is a screenshot of what the enrollment process looks like. So you'll see that each of the benefits are highlighted in blue. So in the event that you ever wanted to see what the differences were, again, from the Benefits at a Glance, you can click on any of these words, and it'll bring up the Benefits at a Glance to show you the differences for there. Once you have selected your preferred benefits, the system will calculate and display the monthly payroll deductions for you. So then at least you know what the premiums would be going forward before you make your before you submit your requests. Once you've done that, you would then review and submit your elections. So again, you can submit your selections, and anything that's in there before as of 8 p.m. Eastern Standard Time on December the 12th will be the coverage that's in place as of January 1st. During the enrollment period, you do have access to our Manulife call center who can support you throughout your enrollment. And in the event that you are having difficulties submitting the requests online, they can take your elections verbally over the phone. In the event that you do choose or you do not choose your benefits by December the 12th, you will receive the default medical and dental coverage without the opportunity to make any further changes until the next enrollment unless you have a qualifying life event. So the default options that have been selected for this plan is medical and dental, both core and single coverage. So it is very important that you take the opportunity to go on to take a look at the enrollment to ensure that the benefits do best suit yourself and your family. After you've done that is we have what's called our coordination of benefits process. So in the event that you have a spouse or eligible dependent that has other coverage, you would indicate this information here. What this does just saves helps in the coordination of benefits process, and it speeds up the process of claims. In the event that there's no other coverage, you would just simply indicate no. After you've completed that, we do suggest that you complete a beneficiary designation form, which would be for all benefits. A beneficiary form is a legal document and does require an original signature, so you can print off the form, complete and sign it, but then you can still send it to Manulife electronically using our Send Files feature, which is available on the Plan Member Secure site. Alternatively, if you choose, you may mail or fax the form to the address or fax number provided on the form. There are a few good things to know in regards to the Manulife benefits, specifically in regards to our claim submission options. We've now made it that we have 3 options of ways to submit claims to Manulife. Our fastest way of claims to be processed is to have the claims submitted electronically from your provider's office. So from your pharmacy, your dental office, or from your provider if they have registered with TELUS Health. So provider e-claims allows healthcare providers to submit the claims electronically on your behalf. So if you ever have any questions on whether or not a regular provider that you use is registered for this service, you can confirm with them directly, or alternatively, you can use our healthcare provider lookup tool to verify from here. So this is also used if you are looking for someone who is a registered practitioner. You can look on this website as well. The next fastest option would be to submit the claims online. So whether that's through our Manulife Secure site or our Manulife mobile app. So what this does is we've now made enhancements that you can submit all types of claims online. And in the event that it does require additional documentation, such as a doctor's recommendation, you would simply take a picture or scan in the recommendation or additional documentation that needs to be submitted and attach it to your claim submission, and it would be sent to Manulife electronically. No more required to send it manually. The next would be to submit a paper claim. Some members frequently will choose to still submit their claims manually, which is perfectly fine. And what will happen is the claims are typically processed within 1 to 5 business days once the claims are received. Signing up for direct deposit on any of these steps is always an option as well. So depending on which way you choose to submit the claim, you just ensure that you get your payment back right away. So further to what I mentioned about the coordination of benefits, there may be some questions regarding the steps on coordination of benefits. So if a claim is for yourself, the claim will always be submitted to Manulife first, as Manulife will be your primary carrier. If you have a secondary policy, so such as your spouse's plan, you would then submit the balance of any unclaimed expenses towards your spouse's policy for further reimbursement. Claims for your spouse will be the opposite. So for your spouse, they will always go to your spouse's insurance company first. And then the unpaid balance can be submitted to your insurance company for further processing, so underneath the Manulife plan. For your children, it would be sent to the insurance company of the partner who has earlier birthday and birth month in the year, and then submitted to the other insurance company as secondary. One thing to make note of is in the event that you and your spouse both have coverage with Manulife, the claims, you would just indicate that in your claim submission, and the claim will go through both plans automatically instead of having to submit 2 separate submissions to the same company. Some tools and resources that Manulife has made available to plan members is our Plan Member Secure site. So as you'll get the experience of getting onto the site when you're going through your enrollment process, this just gives you a little bit more information of what's available. So like I said, it's a personalized to yourself only, and it's very easy to navigate. So most of the commonly used features are available on the home page of our secure site. And what this is so at the very top you'll notice that the enroll and re-enroll button will only be available between November 28th and December the 12th. And after that, this is what you're going to see: submitting a claim, searching my claims, and finding a claim form. On the bottom left-hand side, you're going to see available balances. So if at any time you're curious to know what coverage you have available for, say, physiotherapist, you can then go here to verify the balance that's remaining, and we'll show you what's available at that date that you're checking. On the right-hand side is where you can see your most recent claims. This will show you 5 of the most recently processed claims, but at the bottom, then you can do an advanced search to then complete that, to look for older claims past that. You do also have access to your benefit booklets and forms and brochures if that is something that you would use. You can also connect to the My Drug Plan feature, and you can also view and print your wallet card. So depending on the number of dependents that you have, if you select family coverage, you are going to receive 2 benefit cards. So in the event that you say you have an overage dependent who's going to school and you want to make sure they have a benefit card, you can go onto the Plan Member Secure site to view a PDF copy of the card and print it, and they would be able to take it with them. Alternatively, the benefit card is available on the mobile app. So like I said, our mobile app partners up with our Plan Member Secure site. So you can access the same information that's available. So viewing your most recent claims, submitting a claim, viewing your benefits card, which your benefit card can be saved to an Apple iWallet. You can see your available balances. You can use the My Drug Plan feature, as well as the Pharmacy Savings Search. The My Drug Plan and Pharmacy Savings Search, as I just previously mentioned, are resources that we've made available to become a wise consumer of pharmacy benefits. So in the event that you're ever prescribed a medication, we've made it available to you that you can enter the information into the My Drug Plan app to find a lower cost alternative drug if available. So in the event, we're not saying that we're trying to go against what your doctor is recommending, but it's just giving you a little bit of more education on the information that's potentially available to you. So let's say you're prescribed a medication that requires prior authorization. What you can do is you can then go on, find out that it's a prior authorization, tell your doctor that you need this form filled out. You can get everything filled out while you're in the doctor's office. You don't have to then submit the claim, find out that additional information is required, go back to your doctor's office, and then submit the claim again. We've done this so that you have the information available at your fingertips. Next is our Pharmacy Savings Search, which is a very unique feature, and it's very well used. So what this is again, in the event that you've been prescribed a medication and you need to pick up your prescription, it helps you to find a local pharmacy for the best value of your prescription. So you would just indicate the drug that you're looking to purchase, the radius in which you're willing to go. So let's say you're at home and you're willing to go 10 kilometers to go to a pharmacy. Once you enter the search parameters that you've in there, it'll give you a list of all the pharmacies that are available within the search. And it'll give you the cost that it would be for each of the places to go. So let's say for under your plan, you have a $10 dispensing fee maximum. Let's say in your search parameters, it brings up a Shoppers Drug Mart, a Walmart, and like a mom and pop pharmacy. It'll show you the difference in cost for you to go to each of them because most of those places will have a difference in the dispensing fee. For instance, a Shoppers Drug Mart has an approximate dispensing fee between $12 and $12.50. So you'd know in that situation, you'd be paying at least $2.50 out of pocket for that expense, just strictly based on the dispensing fee. And then with keeping your well-being in mind, we've also provided you access to what we call our Health E-Links and Health Risk Assessment, as well as our Financial Wellness Assessment. Both of these features are available to provide you resources to basically assess where you're at in health and in financial wellness. So for the Health Risk Assessment, it is a comprehensive risk profile. So there's a questionnaire that you would complete that takes approximately 20 minutes to respond to. At the very end, it'll provide you where you rate on each of the risk features. From there, you can also create an action plan to improve upon that. So as you'll see at the bottom of the screen, it just shows you medical screening, your weight, and healthy eating. And it'll say score. So, and it says it'll be low, moderate, or high. That indicates the risk of that you are at based on the answers that you had provided. So what you can do is you can set a personalized action plan to improve upon any various area that you'd like. And then what you can do is you can save it, and then you can go back in and run the report, say, again in 6 or 12 months to see if you've improved upon where you're at. So it's just kind of nice. Anything that's information regarding the health risk assessment is completely confidential. The information does not go back to your employer. It does not come back to Manulife. It's only for your use only. For the financial wellness assessment as well, this just helps members look at their financial situation holistically. So it looks at budgeting, debt management, retirement planning, investment, financial stress and protection. And it also provides videos and tools as well as worksheets that can be used to enhance their financial wellness. Then we have what we call our workplace solutions for mental health. So mental health has become very important and very well known in today's world. So what we've created is a database to help understand the common mental health issues that are available. In the event that this is something that would be used, you can find treatment or support resources within your own community. And you can also view videos or articles to help you maintain your own mental health. This can be accessed through www.manulife.ca/mental health. So if this is something that you'd be interested in, I suggest to take a look when you have a minute. And then what we have is our Discover Hub. So this is a website that Manulife has created that provides 30 to 60 second videos of demonstration of how to use digital features that are available to yourself as a plan member. So again, it's www.manulife.ca/discover. And you'll notice that when you go onto this page and take a look, as new enhancements are made, the new videos are posted by our employees just to show you how to use these features. So let's say, just using here, you want to know how to submit a claim online. There's a video here that shows how to submit the claim online. If you're looking at how to add your benefit card to your mobile device, it'll give you the video, and it'll give you screenshots as well to go from there. And then there are some important reminders. So as I said, Manulife has a toll-free 1-800 number that's available to you as plan members. So during your enrollment, if you have any questions, you can reach out to them. They can assist you with your enrollment if you have any questions regarding the coverage or a premium of any information. Our call center is open Monday to Friday from 8 a.m. to 8 p.m. Eastern Standard Time. It is available in French and English, but there is also 150 additional languages available by conferencing in an interpreter. Alternatively, if you wish, you can contact us online by using the Send a Note feature. What this does is it sends an email directly to our customer service department. They would look into your query for you and respond back within 2 business days. And just a reminder to submit your claims to Mannion Wilkins for 2018 by January 31st of 2019. Also, if you require any 2018 history claims statements that are needed for income tax purposes, you will need to download those by the end of the year. And lastly, we want to ensure that you take the opportunity to enroll to ensure that the benefits you're selecting will be best suited for yourself and your family. Now that we've gone through all of the details, is there any questions that have come up regarding the presentation or the plan itself?
So before we do that, Elise, I just want to kind of wrap it up. It's Lorene speaking again. So
yeah, no problem.
Thanks for all of that information. Just wanting to highlight some of the areas that Elise took us through and how they sort of tie back to the overall engagement survey discussion and benefit survey discussion. Certainly, we wanted to have the ability to go online, look at our profiles, look at our outstanding claims online through apps. You know, we wanted mobile wellness resources, and certainly the Manulife tools offer that. We wanted more flexibility to go to different levels of coverages. We have that. We talked about there was a lot of discussion about long-term disability and the cost of the long-term disability being too high. So we have and will see a 20% reduction in those rates starting in January. Vision care is now a higher coverage on the enhanced option. There's higher coverage from the dental plan on the enhanced option. We're able to mix and match, so to have enhanced and dental core or vice versa. I'm able to do that. You no longer have to keep both at the same level, so that's a nice win. We have 2 plans instead of 3, kind of simplifying things a little bit. And then we have really some additional voluntary benefits that I don't need to enroll in, but if they're necessary or required or valued for me as based on my situation and my family, I'm able to then opt into a optional critical illness insurance, as well as perhaps look into post-retirement benefits if I'm not at that stage of my life. So some nice additions there that I don't need to sign up for, but they're there if I need them. And, I think a lot of these, as I mentioned, were really based on the overall feedback of the organization. So I think Manulife is going to provide us a nice new plan against what we have today and offer us some nice choice. So with all of that said, we do have some time. It's about 11:44 Eastern, so we do have some time for questions. So please feel free to open your lines now if you have questions, or if you have questions and you want to put them into the Skype conversation link, please do that, and we can answer them there as well.
All right, I have a question. Lorraine?
Sorry, I heard Rob. Go ahead, Rob.
Yeah. So I'm a Plan C currently, and I maximize my chiropractor and massage on an annual basis, but looking at this, it looks like I'll be paying more out of pocket. Is that correct?
At face value, it looks that way because the paramedical maximums under Plan C are quite high currently, so they're $500 per paramedical maximum under Plan C. Now, the rates and the premium rates for Plan C are also quite high. So on the enhanced plan in the future, the rates will be lower than they are with Plan C. So you should see an average of $1,000 reduction in premiums annually, as well as the addition of the healthcare spending account. So the combination of those are meant to allow space and flexibility for payment of the paramedical maximums that might not be covered under the enhanced plan going forward.
I have a question.
Yeah, go ahead.
Sorry.
Yeah. Okay.
My question is, my son is currently attending college. He's on my plan with Manulife Wilkins. How do I go about putting him on my new Manulife plan? Do I need to get a certificate of enrollment like I had to do with Manulife Wilkins?
So no, my understanding is that the data that is currently with Manion will be transferred over to Manulife. So if you have a registered dependent that is attending a post-secondary institution already on your program, that should transfer over into your new Manulife profile.
Okay, because every 6 months or so, they make me have my son get a new certificate of enrollment, and it costs every time. I think we do this about 4 times a year. I wonder if I'm going to still have to keep doing that with Manulife.
Elise, can I default to you on that? What's the time frame of which you need to provide that proof of student?
So with Manulife, we only require the student status to be updated at the starting of each school year. So for instance, if you've already updated it right now with Manulife Wilkins, then again, that will carry over like Lorraine said. But if your son is still in school and under the term age, so let's say he's still under 25 next year, you would just need to update his student status come September of 2019 for the coverage to continue. And then what would happen is it would then continue from September 1st until August 31st of the following year until he reaches the term age. So if he's continuously in school, then then it's only once a year.
Okay, so do I get notification that I have to provide that again, or is that something I have to remember because I don't want to lose him off my plan and have to go through the whole rigmarole to get him back on? Do
Yeah,
I get notified?
Yes, so notification will be sent out. The process is going to be changing for what it was this year, but notification will be sent out to members just letting them know that you have an overage student. You need to update the student status by the end of August for the coverage to continue. The good part is that in the event that you do happen to forget about it, which happens quite frequently, and you say your son goes to the dental office in October and the claims declined, what would happen is once the student status is then updated, it gets backdated to September 1st again, and any claims that occurred would then be processed through. So you're not going to ever be penalized if you happen to not update it before the September 1st, but we still encourage you to do it as possible, but notification will be sent out.
Wonderful, thank you.
No problem.
One of the people here in Ottawa wants to know, when with the denture part, he saw 50%, and he's wondering what that is about.
So what that means is that the amount of the claim, is when the claim is processed, it'll only be processed to a maximum amount of 50% coverage. So if it's $1,000 for a service and the full amount is eligible and the coverage is at 50%, then up to $500 would be eligible. For for major services, we do recommend that you submit an estimate to Manulife. That way you know ahead of time the amount that will be eligible, and then you would know and you would be made aware of any out-of-pocket expenses where applicable. So it's just the co-insurance, so you'd be covered. The amount that's covered would be 50% of the procedure.
Yeah. Okay.
That's less than.
He's saying that's less than Mannion's was.
Hello?
Hello?
Yes, I'd like to ask a question.
Yes, just 1 second. If I can just ask you to hold that for a second. Sorry, what was the last comment there from Ottawa?
He was just saying that the coverage is less now for dentures than it was with Mannion's.
Okay, I can have our benefits team reach out directly if necessary. If you want to just send me an email. Lorena Cushing?
Yeah.
Yeah.
Okay.
Okay, sorry, what was the next question, please?
Yes, like say you were to pass away, does your spouse or whoever your beneficiary is would get 1 times salary or 2 times your salary?
So that coverage isn't changing. So today we have 1 times our annual salary. That will remain the same under Manulife. And you will need to assign a beneficiary through the enrollment process for your basic life. So once you go into the Manulife platform, it will prompt you to assign a beneficiary. Now, just a quick side note, this beneficiary activity is different than the beneficiary that you may have in place for your defined contribution pension plan if you are in that plan. So don't assume that the beneficiary that you assign here for basic life also transfers to the defined contribution pension plan. That is a different form, a different activity. So if you have a change to that, you will need to reach out to Great West Life and change your beneficiary there.
All right, Brian here. I got a question I posted on the conversation about the optional critical illness coverage.
Yes.
And basically it's, how does it work if you have a dependent that has an existing diagnosis, considering that under 50K rule where you don't need proof of health? So do you need to have a new diagnosis in order to qualify for that?
Elisa, I'll have to defer to you on this.
So that would be something that we would have to take a look into, based on what you're saying. So we'd have to take that offline, and we can look into it, and then I can get Lorene to relay that back to you.
Okay. Please connect with me. Thank you.
Yeah, and Pam has a question as well. I'm just going to click in here. Do we pay for the prescriptions in full or just the dispensing difference? Elise, can you comment on that?
Yeah, I sure can. Just want to see what the question is. Okay, so when you pay for prescriptions, you would just be paid based on the selection that you've made. So for instance, in the coverage when I was going over it, there was the difference. So whether you had Cord Enhanced is different coinsurance, one was at 70 and one was at 75, one was at 90. So what would happen is the pharmacy would submit the claim to Manulife directly on your behalf and would advise you of anything that's outstanding to be paid. So using the 75, if you had the 75% coverage, so say it was $10 and the dispensing fee was the same, so let's say it was in total $25 or $20, you would have to pay the difference of like so you'd have to pay the 25%. So it just depends on the level of coverage that you've chosen. It's kind of hard to explain without knowing the coverage that's been selected, but there will be a minor difference just based on what level of coverage you've selected. So you'll see when you do look at the benefits at a glance that there are the different co-insurances or the percentages, and then you just base it from there. Does that answer the question, Pam?
I believe so. So when the pharmacy is submitting that claim, do they get that information back right away?
Yes. They'll get the amount back, and if there's say $5 outstanding, they'll let you know, and then you'll pay the difference. You wouldn't have to pay the full amount and then receive the reimbursement back to yourself. It'll go direct. The amount that's eligible will be paid to the pharmacy, and you would just pay for anything additional.
Thank you.
If somebody is on STD or LTD during this change, what happens?
If somebody is currently on STD, they are currently covered under a different program. They're covered under the program that's in place today under Coughlin.
And it'll stay till it runs out.
I'm sorry?
Well, I'm going to be going on STD starting December 10th.
Okay.
Until January 2nd or January 10th. I'm not sure because I'm having surgery. So do I have to do anything?
I don't believe so, but I think what ends up happening is that the STD, if you're on an STD currently, that just carries through and wraps up under the current plan. Okay. Any short-term disability that starts on January 2nd would just begin under the new program. So it's a good question, and I'll just give you some, high-level details about short-term disability programs. The very specific details are still being worked out with the administration team at Mannion. But basically, today, if you are on short-term disability, you are paid by Wolseley, and you are paid through Wolseley payroll. Yep. In the future, under Manulife, you will not be paid by Wolseley. You will be paid by Manulife, and you will be paid weekly, and they will deduct taxes, and you will receive a T4A. So it is a different program, details of which and changes of which will come out. But the coverage levels will be the same. You will still receive 70%. It'll be still coverage from day 1 on a hospitalization and coverage from day 7 on an absence.
Okay.
If you wanted to just send me a quick email, and I can just make sure I can just confirm with the benefits team on this, that's how I understand it to be happening, but I do want to confirm. So if you could send me an email and I can follow up.
Okay, Lorraine. Thank you.
And just one thing to add, Lorraine, as well, if anyone in the situation that was just described, she should still be going on to complete the enrollment so that she does have the benefits and not default to the default coverage.
Yeah, I was going to.
Okay, perfect.
Yeah.
So chiropractic is not included in the paramedical, as I understand, Elise, and so
Correct.
those charges would need to be covered by your healthcare spending account.
Yes, that's right.
Yeah, that was just a question in the text here.
Yes, there's only the coverage for the 4 practitioners now, so anything additional, so massage, chiropractor, those would be eligible under the healthcare spending account.
Is there going to be something sent to us, paperwork regarding when to do the enrollment or?
Yes, absolutely. So there will be a communication that comes out from corporate communications saying it's now time to enroll and here's how you do it. That will be coming in the next couple of weeks. I think, I'm not sure of the exact deployment date, but the enrollment period starts on the 28th. So I think it's going to be either late the week of the 19th or the 26th.
Okay, perfect.
And then there will be reminders saying sort of you got 2 days, 3 days left, 2 days left, 1 day left. But if there are managers on the line, it's important that you are advising your employees to go on and register. Everybody has to register for an account, and everybody has to do the enrollment because Manulife is now the provider for our basic life insurance. We all have to designate a beneficiary for that, et cetera. So there should be 2,900 people going into that enrollment site. So it's important.
Okay.
I'm happy to provide the slides as well if you're interested in that. I can ask our team to send the slides to everybody on the call today.
Yep.
So that you have those in your back pocket if you have questions.
Actually, they just sent them. We have them now.
Oh, you've already sent them. Great. Okay. Are there any other questions?
I'm good.
Okay. If there are no other questions, we'll close the call. Thank you for joining us today. And if you have any questions directly, please reach out to me or any members of the benefit team or HR support, and we will answer your questions accordingly. Have a great weekend, everyone. Thank you.